It's said that we stand on the shoulders of giants. That's certainly true in the chiropractic profession, and equally true in the area of technique that I teach. And one of those giants, one of those greats, was Dr. Stillwagon, Glenn Stillwagon. I believe he was originally from Pennsylvania, in fact, the Pittsburgh area. And I heard him speak multiple times while I was still in college. Of course, he was well known at that time for the Pierce-Stillwagon technique. Dr. Pierce and Dr. Stillwagon collaborated, and they had a unique approach to the spine that still exists to this day. Certain corners of the profession that still use the Pierce system or the Pierce-Stillwagon system. One of those times that I heard Dr. Stillwagon speak, he said something that really captured my attention. I've never forgotten, even though the details may be lost. But he was speaking about the AS-ilium, and those of you that remember the Pierce-Stillwagon technique, they had a unique way of looking at the obturator frame, and he said that the AS-ilium represented only 3, or it may have been 5% of his patient population, and interestingly enough, they were some of the first chiropractors to even own a computer, no less, collect statistics. And I remember thinking, wow, that's a very small minority of patients. In ensuing years, I've come to agree with Dr. Stillwagon, with one exception, that if you exclude the male population, your male patients from that statistic, the percentages rise significantly. I would say easily as much as 15% of your female patients, maybe even as much as 20%, have what I'm convinced is the AS-ilium. There's certain hallmarks that you'll see, which I don't have time to go into, but using the muscles themselves, I'm going to show you quickly how to find the AS-ilium. You don't want to be adjusting these people with a typical P/A, posterior, the posterior to anterior side posture adjustment, contacting the PSIS. You're actually going to cause chronic pain syndromes and even disability. I can go into that in more depth at another time, but right now I'm just going to focus on, so this represents the gluteus maximus, deep under this area in the iliac fossa, just lateral to the PSIS, you'll find the gluteus medius. And I recommend in this area using your thumbs for palpation because it's such dense tissue. You go in here and you'll find the gluteus medius has increased activity. You'll also find just below it the piriformis muscle, which will also oftentimes be active because the posteriorly rotated sacrum is pretty much a mirror image of the AS-ilium. Now, again, these people do not do well under traditional chiropractic care if the chiropractor is not either taking x-rays and finding AS-ilium or palpating and knowing how to discern the AS-ilium through the gluteus medius muscle or the piriformis muscle representing the posteriorly rotated sacral base. These people, unfortunately, this takes place oftentimes during pregnancy when the female pelvis is relaxed with the where the pelvic ring expands because of the relaxin hormone, and then the weight of the baby just leverages that pelvis, and it creates this chronic AS-ilium, oftentimes bilaterally. The real problem here is it can cause tension in the ligaments, which will then not allow the baby to turn vertex, and you'll end up with a breech carry. I have never ever, first of all, I've never promised to turn a baby, but I've had many breech pregnancies referred to me by midwives, many over the years, and I've never seen one that didn't turn, oftentimes the same day or the next day after correcting the pelvic imbalance. Very often it involves an AS-ilium. Of course, you have to look at the entire picture. You've got to check the lumbar spine and check for other misalignment patterns. But the AS-ilium is corrected very effectively, almost easily through contacting the ischial tuberosity not the PSIS. And I can't caution you enough. You don't want to address this as a cookie cutter adjustment without examination. You don't want to manipulate these spines. You don't want to address it aggressively. These women are often already in a lot of pain. Even many female chiropractors that have come to the seminar or students, and they're getting adjusted, bang, 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 these routine side posture adjustments. It's aggravating it. They'll come in oftentimes to your office. They've got a little bit of a limp or a gimp because they've been adjusted incorrectly. Really, their spine has been manipulated, not adjusted. And there's other hallmarks, but this gluteus medius is like gold. It will tell you oftentimes that it's an AS-ilium. I'm sure there's Thompson checks, leg checks that can also, alert you to the AS-ilium. But through AMP, this is a really straightforward way of, at the very least, knowing not to address this through a posterior to anterior side posture adjustment. You can put these folks side posture, address the ischial tuberosity. It's not recommended, especially during pregnancy, because in order to bring tension to the joint, you've got to put them into flexion. Using a wedge, a simple foam wedge. I have one actually right here. You can get these oftentimes through the CVP suppliers. You just put the foam wedge as the patient's lying prone under the anterior aspect of the iliac crest, and that preloads the pelvis posteriorly, and then contacting the ischial tuberosity, bring it to compression, or use your drop pieces. But this is like gold for those women. It's often like taking the thorn out of the lion's paw, and they will be forever grateful because no other chiropractor has been able to resolve these issues for them.